Yeah, Jana, so for this, we want to cover the HSS report from the US. The draft report came out in May, and there's an updated peer-reviewed report that came in November. So most people won't be aware of this because it's not covered on the mainstream. And I'm basically saying it does go further than the CAS report. So I think let's get into it, I guess, and understand it a bit more. So this was the CAS report, just a quick recap, I guess, and it talked about it. These are the kind of summary points from the CAS report: the poor quality of the studies, the evidence base was weak and often misrepresented and overstated, etc. The rationale for the early puberty suppression unclear, and obviously there's harm associated with that. And then using the masculizing, feminizing hormones for younger people. Again, there's no research base to tell you what the outcomes are going to be, and we know that there's problems with all of those things. So there's no certainty as to, when you have a cohort of young children expressing gender confusion, which ones will actually persist and which ones will resolve. As we know, when they get past puberty, etc., a lot of children it does resolve. You just don't know. So you're kind of, there's a huge risks. And they're basically saying that those outweigh any potential benefits that people are arguing for, because the evidence base just isn't there. So this was a summary. Most young people, medical pathway will not be the best way to address their distress, because something else causing that distress, abuse, autism, same-sex attraction, etc., all those other things. There isn't an evidence base there. And you've got to address the core mental health issues at the heart of the child's distress. That's the issue. You have to get to the bottom of it. And that's the best way of, if they've got suicidality, etc., you'll address that as well as part of it. So that was a summary
of the Eugene, it would be malpractice with any other psychiatric or physical condition not to explore the root problem and treat that from a holistic point of view, to just affirm the condition, whether it's a young girl with an eating disorder. A doctor wouldn't just say, yes, you're fat, stop eating, get your gastric band. So with the trans agenda or the trans identifying child, they're just affirming, not exploring the actual reason. So why wouldn't that be deemed as malpractice?
Yeah. And the problem we have is that there's an unwillingness on behalf of the trans activists to engage in a medical scientific discussion. They don't want to engage in that, and neither do the media that support them, like RTE. So they don't want to have that discussion. And we do have our own clinicians in this country, the medical doctors who are involved with the gender services area, and they do want to have that discussion because they want to do the best thing by the children. Now, the CAS report, I guess, it's a level of inconclusion here. I would put it that way, right? So it's saying there's no evidence base. There isn't the risk reward benefit aspect of engaging in this stuff is just, there's nothing to say that it's warranted. It just isn't. So here's the HHS report. This is based on a meta-analysis of research. And people have gone through, they've scoured through the research. That was the brief that the team of people that put this report together had to do. We have a video. There is a video, Jana. It's about an hour and a half long. It's an interview with all the authors of this report, talking about it and talking about their experience and their perspectives on it, etc. I would advise people to listen to that. You don't have to read the whole report. There is a summary version of it as well, as well as the full report. And it highlights a number of things. You can see it here. The growing body of evidence pointing to significant risks, including an irreversible harm such as infertility, associated with puberty blockers and cross-sex hormones. And there's very little, that's an absolute, whereas there's very little evidence of the benefit side of things. This is the issue. This is the huge problem. And this weakness has been a consistent finding of systemic reviews of evidence around the world. See, this is a global study that's been done here. It's just because it's coming from the US, they're taking evidence from around the world. It's a global report, this HHS report. And they talk about it here. Our duty is to protect our children, not expose them to unproven and irreversible medical interventions. Right. So this is what it talks about. So there is a summary version of it, which is a pretty short read. I think you'll probably read it in 5-10 minutes, to be honest. But you can download it. We'll provide the links in the description so you can read the summary. Here's one of the key points: the suicidal ideation, Jana. So many people talk about the fact that, oh, would you prefer a dead child or a trans child? Because the child is saying they're suicidal,
Or they say
etc.
a living, would you prefer a living son or a dead daughter, or any
Yeah,
of that
dead
nonsense?
daughter.
But the
Yeah,
facts don't back that up at all.
they don't, and they really don't. And they're saying that the suicidal ideation is associated with the comorbidity. And I think if you look at the studies, I think pretty well every child that they look at has at least one comorbidity.
Yeah.
There's at least one thing that you can take that's some other thing that could be, and many of them have multiple. Many of them have multiple comorbidities that need to be addressed. These are poor children that are quite distressed. And it doesn't help that you teach them stuff in schools like they do now, right? So they said there's no independent association between gender dysphoria and suicidality, right? So that is a lie. That whole thing is a lie. And there's no evidence that pediatric medical transitioning reduces the incidence of suicide as well. So that's the next thing. So the fact that you do medicalize them and all of that and affirm them, that actually doesn't address the suicidality. And the reason is because the suicidality is because of something else. It's because of one of those other comorbidities, and you haven't treated it. We have it from the WPATH files, and we'll put links into the description for the WPATH files. This is basically where we have recordings of the WPATH people talking about the fact that the children can't in any way be able to make a decision, an informed decision at the age that they're making it. They just don't know. The notion of their future fertility is like a child isn't thinking about, oh, I might want to have children, myself in 10, 15 years time. A 10-year-old isn't going to be thinking like that, right? Just is incapable of thinking like that. And unfortunately, we're being asked to affirm the 10-year-old in their gender distress. That's what people are trying to push.
They're not old enough to make those lifelong decisions. I mean, there's a reason why there's age limits on certain things. Like my children are 7 and 10. They can't get a tattoo, smoke cigarettes, buy alcohol, or drive a car because those are decisions that a young child cannot make. However, the youngest child from Ireland, I believe, that was sent over to the Tavistock, I think was as young as 5. So how can a child who's 5, who still believes in Santa Claus, the tooth fairy, and they can't drive a car or get a tattoo, but they can make a lifelong decision at age 5 that will affect them for the rest of their lives, their bodies and their fertility? I mean, that's lunacy.
Well, that's where you need your parents to protect you and do the right thing and get you to get the proper medical help. The dearth of research on psychotherapeutic approaches to managing gender dysphoria in children. So the mischaracterization. Some people are saying that these practices are conversion therapy. Like you've got a gender confused child who's suffering from trauma or whatever, and you're not willing to engage in that psychotherapeutic care that they need because you think it's conversion therapy, or you're claiming for ideological reasons that that's what it is. We talked about this in other videos. So they're saying a more robust evidence-based supports psychotherapy approaches should be used because you're talking about these children have comorbidities, comorbid mental health conditions, as they say here. This is from the report. This is a quote from the report. And it's not invasive. It just isn't. You can walk out of that. You're still the whole-bodied person that you were when you walked into that treatment. Unlike other treatments when you're taking drugs, etc., and surgeries. So they're really saying that this is the way we should be going, and you shouldn't be banning this as conversion therapy, which is what some people are attempting to do as well. And they're saying here again, systemic reviews of evidence have found no evidence of adverse effects of psychotherapy in this context. Right. Okay. So the summary. I've only taken a couple of examples from the summary part of this report, but people should read it. It is a short read. It's not too much. There is the video you can watch. And we'll include some videos and some links to the WPATH stuff, because that tells you that WPATH knew that these children were not in a position to make an informed decision and incapable of doing so. And in many cases, because they had these other mental health conditions as well, quite apart from their age and immaturity, they also had other comorbidities as well. So that's it, Janet. That's a quick update on the HHS report. It's not covered in our mainstream media in Ireland. It supersedes, in my opinion, the CAS report. People would have seen the CAS as the gold standard. I would argue that this is the gold standard now, because this is a more comprehensive report. It's gone through much more thorough review. It covers a much greater expanse of evidence, or lack of evidence, as the case may be.
There's enough evidence between the HHS report, the CAS report, the leaked WPATH files, reputable organizations like GenSpec, that the question I would have is, why would anyone believe and take advice from an ideological trans activist NGO like Belong To or TENI and ignore the medical best practice? So we have all of these reports and organizations which take an evidence-based approach, a medical approach. Why would anyone look over there and take advice from an ideological trans activist affirmative NGO approach? It makes no sense at all. So take a look at the evidence, look at it for yourself. And we have also, just to remind everyone, we sent a letter to every parliamentarian in Ireland in every school. It was a long letter, a 7-page letter. You can look on the naturalwomanscouncil.com, a letter we sent. We reference the HHS report and the CAS report. So there's no parliamentarian or school that can say they didn't know about it, because we sent it all to them. You can read that letter with all of the demands that we have to keep our children in Ireland safe. So have a look at that letter. We can put the link in the description field, and you can send that letter yourself or take bits and pieces from it. But the main point I would stress, and the ask that I would have from everyone listening, is don't wait for someone else to fix the problem. There's infinite amount of information out there. So don't do nothing, just do something. Take some sort of action. 2 lines to send to your TD. Send a letter to your school, but doing nothing can't be an option. So just do something. We've given you all the information. Just do something with it to protect children. We are their voice. So thanks, Eugene, for putting this together, and have a great day.